Welcome to another episode of While You Whistle. My name is Xingyi Yang, and today I will be talking about a phenomenon known as medical gaslighting. When going to the doctors, have you ever been interrupted or rushed or felt like you were ignored by your physician when trying to tell them your symptoms? It's bad enough that you already had to drag yourself to the doctors when in pain, but it feels like a kick when you're already down, when the person that you put your trust in to help you says, "It's all in your head." You psych yourself out if every time you go to the doctor you think, "Will they think I'm faking it? Will they believe me? How much pain do I need to be in to receive the care I need if my word is not taken for granted?" This is an unfortunately common phenomenon known as medical gaslighting. Formally, medical gaslighting, as defined by Elena Ruiz, is, quote, the interpersonal phenomenon of having one's experience of illness marginalized, including having one's self-reported or presenting symptoms downplayed, silenced, or psychologically manipulated by a clinical provider or healthcare professional, end quote. Medical gaslighting in the healthcare industry has significantly decreased the quality of care that women, especially women of color, receive. This treatment have or could lead to devastating, if not fatal, consequences. In an article published by the New York Times, some patients recounted mixed diagnoses that nearly cost them their lives, or that delayed treatment which led to unnecessary suffering. More on that later. Due to gender discrimination, studies have shown that when compared to men, women face longer wait times to be diagnosed with cancer and heart disease, are treated less aggressively for traumatic brain injury, and are less likely to be offered pain medications. For example, when women with heart disease exhibit different symptoms than men with heart disease, doctors are more familiar with male symptoms. So when women show up with symptoms that don't fit into the algorithm, they're gaslit and ignored because the male doctors don't really know how to handle these symptoms, as they are not taught this in medical school. Commonly, many women have experienced an infuriating display of ignorance from their physicians when, quote, doctors frequently blame their health problems on their mental health, their weight, or a lack of self-care, which can delay effective treatment, end quote. For women of color especially, racism influences the outcome of their treatment, or the attitudes displayed by their doctors during face-to-face consultations. Researcher Michael Sun and others have found that doctors were more likely to use negative descriptive words in Black patients' health records than in those of white patients. Words such as non-compliant or agitated. This is a practice that could lead to amplifying healthcare disparities. Another researcher, Druecki, found that patient race affects pain treatment decisions. And then when that is coupled with the research that diagnostic errors occur in 1 out of 7 patients, women of color are more likely to be misdiagnosed in a variety of situations than any other community. It's somewhat relieving to find that there's a solidarity among those that have been gaslit in a healthcare setting. It is more common than you think. The New York Times published an article titled, quote, "Women are calling out medical gaslighting," end quote, where women shared their experiences of going to the doctors. One woman, Sarah, began experiencing knee pain and swelling in 2016 after giving birth to her son. When she went to the doctors, she was told that she had postpartum depression. A different opinion from another doctor told her to lose weight, when, in reality, she was actually suffering from hip dysplasia. She felt as though the doctors were telling her that her excruciating pain was something that a woman needs to just live through. When another patient, Rami, began losing her hair and breaking out in a full body rash, she said that her male doctor told her she was, quote, young and healthy, but just lazy, end quote, when in fact, later that year, she was diagnosed with grave disease. She also experienced disabling period pain for 20 years before finally being diagnosed with endometriosis of last year. Michelle had her symptoms of systematic lupus mistaken by doctors for allergies and even a false pregnancy. An explanation for the misdiagnoses by these physicians towards their patients could be that, quote, scientists know far less about the female body than they do about the male body, end quote. There is a historical precedent that snowballed into a lack of knowledge displayed by doctors today when, in, quote, 1977, the U.S. Food and Drug Administration began recommending that scientists exclude women of childbearing years from early clinical drug trials, fearing that if enrolled women became pregnant, the research could potentially harm their fetuses, end quote. However, the National Institutes of Health Revitalization Act of 1993 directed that the NIH establish guidelines for the inclusion of women and minorities in their clinical research. Women of color, especially, are, quote, often misdiagnosed and treated differently by doctors than men are, even when they have the same health conditions, end quote. But what exactly causes women of color to have worse experiences with their healthcare providers? The answer is clear-cut: racism. Sun and other researchers found that, quote, when compared with white patients, black patients had 2.54 times the odds of having at least one negative descriptor in the history and physical notes, end quote. And again, these descriptors would be those that are mentioned before, such as having words like non-compliant or agitated in the patient's record notes. Implicit bias also plays a role in this treatment. Implicit biases, quote, involve associations outside conscious awareness that lead to a negative evaluation of a person on the basis of irrelevant characteristics such as race or gender, end quote. And this definition was from a scientific article written by Fitzgerald and Hertz. Now, Fitzgerald and Hertz have found, surprisingly, that healthcare professionals exhibit the same levels of implicit bias as the wider population. These implicit biases from medical professionals towards patients of color taint clinician-patient interactions and are unfortunately likely to influence diagnoses, treatment decisions, and levels of care. So how do you recognize medical gaslighting? It's important to recognize the symptoms as soon as it's happening in order to stop it in its tracks and prevent it from going any further. Another article from the New York Times lists out the symptoms. Here's what you should look out for. 1. If your healthcare provider is being rude, condescending, or belittling. This could mean that they're interrupting you, they refuse to let you elaborate any further about your symptoms, and they're not an engaging listener. AKA, they don't make eye contact, or they don't nod or listen along or follow along with what you're saying. 2. Your healthcare provider refuses to discuss or downplays your symptoms. For example, this could mean that they're minimizing your symptoms, or they're constantly questioning if you're in pain. 3. Your healthcare provider refuses to take necessary action to further support a diagnosis they have. So they will not order key imaging or lab work in order to rule out or to confirm a diagnosis that they just gave you. And 4. If your healthcare provider says it's all in your head, your symptoms are being blamed on mental illness, whether or not you've had a mental health illness diagnosed or not in the past. So how should you approach this if it's happening to you? We can combat this and prevent medical gaslighting from continuing by starting off with these solutions. 1, you can keep detailed notes and records of your visit and of your symptoms. For example, you can answer these suggested prompts. What are your symptoms? Why do you feel like you have those symptoms? Do you notice any triggers? If you have pain, what does it feel like? Does it wax or does it wane, or is the pain constant? And what days have you noticed this pain, and how long has it been happening? In addition to these notes, you also should keep records of your lab results, imaging, medications, and family medical history. 2, you want to ask questions and then ask more questions. Prepare a list of questions that you would like to ask ahead of your appointment, and then be prepared to ask other questions when you receive new information. If you're not sure where to start, you can ask, if you were me, what questions would you ask right now? 3. Bring a support person. It's very helpful to have a trusted friend or relative accompany you, especially if you're discussing a treatment plan or difficult medical issue. They can be your insurance as a second set of ears to confirm what your doctor is saying. You can also ask them to take notes or be there for emotional support. 4. You want to focus on your most pressing issue. You only see your healthcare provider for a short amount of time, and the average primary care exam is only about 18 minutes long. So, you should take 10 minutes before your appointment to jot down any bullet points and clearly and concisely outline the reason for your visit so that you can communicate with your doctor more efficiently. And 5, you want to pin down the next steps. So, you should leave your appointment feeling reassured. At the end of the appointment, your provider should tell you these 3 things: their best guess to what is happening, the plans for diagnosing or ruling out different possibilities, and the treatment options depending on what was discussed. So if you think something is wrong, it is not just in your head. Many women are going through similar experiences, and speaking out and acknowledging your doctor is the first step to correcting this behavior. Sources are in the description below and can be provided upon request. Thank you.